My talk at the WCC was a talk on using human rights law to address cancer prevention and control. And I was sharing experiences from Africa. I specifically focused on Uganda as a case study. Of course, given that we had a very limited time, I just focused my presentation on Uganda. Yes, I have some case studies, and maybe just to really place human rights law so that it's clear from the beginning. So, in Uganda, human rights law is well elaborated within our national constitution, and specifically under Article 24, under Article 24, which is the Bill of Rights. And within this, that's where you'll find the right to life, the rights of women, the rights of people with disabilities. You'll find you find all those rights. And although the right to health is not explicit in our constitution, but it can be inferred. And indeed, we've used it and had a lot of success in the country. Also, human rights law in many countries, and indeed my own country, could be traced within progressive laws. Specifically, there are countries with progressive laws on cancer. In Uganda, for example, we have a law on national law on cancer, and it's the Uganda Cancer Institute Act of 2016. And also we do have patient rights and responsibilities charter. Still, you'll trace human rights law there with principles and standards and provisions that, for example, look at accessibility, availability, affordability, and quality of services. You'll find principles such as non-discrimination and prevention of stigma, gender equality issues. You find all those within the human rights law provisions. And in terms of examples of how we have used this, maybe I'll speak a little about the National Cancer Law in Uganda. So this law creates an autonomous body that coordinates and manages all cancer affairs in the country. Including the formulation of policies and standards and guidelines, including oversight for cancer services within public health facilities and also private healthcare facilities, including the decentralization of cancer services, including there is that overarching body which has the mandate to really provide leadership. Why is it important? It's important because then you cut out that empowering law cuts out all the bureaucracies related to cancer prevention and control, and you find that because of that particular law, you find that we've seen progressive increment in the budget, in the funds that are allocated to cancer prevention and control from government. Between 2016 and now, the budget has increased by more than 60%. And partly it's because we have that autonomous body. Also, we've seen in the country, in 2016, when that law was passed, we had one radiotherapy machine, Cobalt 60, in fact, which broke down in that same year. And we've made some progress. We have 6 modern machines right now. So the expansion of radiation services in the country, because the law mandates this autonomous body to decentralize cancer services, we've seen government put in some money, of course, with other development partners, for establishment of regional cancer centers. As I speak now, we have a regional cancer center in northern Uganda. We have one in southwest, and there are about 3 more to be established. And of course, that comes with more equitable access to services. Also, previously, without that this enabling law, specialized cancer medications were procured through third parties, and specifically the national medical stores. And of course, in most of our countries, most of the development countries are still struggling with issues of stockouts, supply and other supply chain challenges, But this law empowered the Cancer Institute to be able to directly procure specialized medications like chemotherapy. This means that third parties are cut out, the timeliness is also catered for, but most importantly, the quality of the medications. And it's addressing equitable access, because even the most vulnerable and most poor person, when they get into the institute and they need expensive chemotherapy, as long as it's on the list, they are able to access it. There are many other things that have happened because of this law. Of course, the Cancer Institute in Uganda is recognized as the East African Oncology Center of Excellence, that is even giving technical support to the rest of the region, including Democratic Republic of Congo. And it's because of its autonomous nature, it's able to receive multilateral grants, like from Africa Development Bank. We've seen, again, because of that autonomy and no bureaucracies for a government institution, the expansion of partnerships and collaborations. So there is quite a number of things that have come with it. But despite all that, it's very important that this institution that is mandated is able to balance the clinical work and the policy development. And I see maybe that's where there is a challenge, that for a cancer institute that is traditionally focusing on service provision and research and training, I've seen that the policy side of things actually suffers. Yeah. So maybe what I did in my presentation, the other important thing is I elaborated how we have that was just about national cancer law. But I also was able to share how my organization has used human rights law to advance the right to health in other areas of health. And I specifically shared the experience we've had around litigation in the area of maternal health. So the country has always had high maternal mortality ratio. And in 2016, our maternal mortality ratio was 336 per 100,000 live births. And so before that, in 2011, we actually filed a case in the Constitutional Court of Uganda, together with two families that had lost loved ones while they were giving birth. And our arguments were that government has failed to meet its obligation of ensuring that there is basic maternal health care. And we had different arguments. The fact that public healthcare facilities are not supervised, leading to preventable maternal mortality, stockouts of drugs and supplies. Of course, there was also unethical behavior by healthcare workers, the low budget going to maternal health. And so we had all those arguments that we filed in court together with the two families that we identified. And that was in 2011, and we walked a 9-year journey in court processes. And finally, towards the end of 2020, we had a landmark constitutional court judgment in the affirmative, with court agreeing that yes, indeed, government neglected its legal obligation of protecting the right to health, specifically having women die because of lack of basic maternal health or maternal and obstetric services in public healthcare facilities. And what are the positive things that this judgment brought to Uganda? First of all, this judgment placed maternal health, the right to maternal health care, and indeed the right to health broadly within the Constitution of Uganda. We use common law in Uganda, so any precedent like that becomes law. So we now know that via that precedent, we have the right to health placed into our Constitution. And of course, many things have happened. There were court orders where, for example, court was asking the Ministry of Health to submit to prepare a report on the status of maternal health in the country and submit it to Parliament, submit it to court. Again, court was instructing government, ordering government to increase the budget for maternal health. Court was instructing government to ensure that healthcare workers are well trained, also that lower level healthcare facilities are well equipped to manage maternal healthcare needs. And all these things, we saw that in early 2021, of course, we do celebrate positive court judgment, but what is most important is that these judgments are implemented to impact on the people they are supposed to impact. So we officially approached the Ministry of Health about this judgment, and they wrote back to commit themselves that they are going to implement the judgment, including the orders from the court. What we've seen is quite a significant progress in terms of maternal health care in the country. In 2021, 2022, the first maternal health care audit was done in the country, and this was presented in Parliament. It was presented to court. The ministry also launched weekly surveillance for maternal and perinatal deaths. So there is real-time data every week. The ministry will know how many women have died, from which locations, from which healthcare facilities, what are the causes of death. They also launched a weekly maternal perinatal surveillance and response system where every week everybody gets onto a virtual call to discuss issues or cases, typical cases of women who have died, with leading clinicians who are in charge explaining why. And this is meant for quality improvement. So we've seen such, Ministry has also launched, this is the second year they're going to hold the National Safe Motherhood Conference. So there is quite a lot. We've seen an increase in the budget allocation to maternal health, including life-saving commodities like blood. And so there is so much development that has happened. But what is most important is that maternal mortality ratio within the last few years, especially that whole period of that court case and the judgment, has reduced by more than 40%. So it has reduced from 336 per 100,000 live births to 189 in record time. So we are seeing that there is, of course, perhaps there are other factors that have contributed to this reduction, but we do think that the court judgment has played a significant role. Yeah, so those are some of the things that I was sharing. Perhaps there are lessons for us that we can also use the same approaches, and we actually combine litigation with advocacy, mobilizing the women to speak about them, to speak about their right to maternal health care. And so there were real movement actions from advocacy, women marching to show their support for this case. And also we combined the human rights and public health and gender responsive approaches in this particular case. And I think it's given us a lot of value in the country, especially when it comes to maternal health care. So there has been less use of human rights law in cancer prevention and control. And taking examples such as that, I think we can really use the law much more to advance our goals for cancer prevention and control. I also shared the fact that we had British American Tobacco take the Ministry of Health to court against the Tobacco Control Act of 2015. And of course, the Ministry of Health does not have a legal team, a huge legal team. So as an organization advancing the right to health, we decided to actually join the Ministry of Health and support them with this particular case. And indeed, the Constitutional Court dismissed the case citing the obligation of government to protect fundamental human rights like the right to life, also the right to a clean and healthy environment. So again, these are ways through which human rights law is being used to advance cancer prevention and control. There are also other legal and policy frameworks that could be important. In my country, government has been working on the national self-care guideline for health and well-being to really institutionalize self-care and enable individuals to be able to take care of themselves, to lead in their own health. And the guideline currently is focusing on sexual and reproductive health, but it's also focusing on non-communicable diseases. And you find that cancer, especially, say, self-testing for HPV, also soft breast examination approaches that are included in this guideline. And I think that is going to enhance cancer prevention, especially at community and family level. There are others. Currently, Uganda is Parliament is debating the bill on assisted assisted reproductive health technology. And of course, this is where we were even able to do a legal review of this bill and give recommendations to Parliament that one of the key areas that is important to include in this bill is the issue around cancer, fertility preservation. It's not something we have in the country, but yet it's a human rights argument for such a bill, for such a law, that young people in their reproductive age having cancer and being treated for cancer can actually are able to preserve their fertility. So those are the many different ways we are using to really utilize human rights law in advancing cancer prevention and control, also in other areas of health, and there are lessons that we can take on for cancer prevention as well.